Hi guys, it's Haven from Independent Lifestyles. Today I'm going to be doing a sit-down talk with you about mental health and COVID-19. Before I start, I just want to say that I am not a licensed professional, and if you feel that your mental health is struggling right now, then you should definitely seek help from a professional, whether that is your primary care provider, a therapist, a psychiatrist, your ILS worker, someone that you feel comfortable talking to, such as a friend or family member. I just want you to know that I am not a professional. I am just here to discuss it with you and give you some tips and talk about signs of depression. But if you feel that you need help, you should seek help from a professional. There are many resources that you can go to during this time, since this is something that a lot of people are struggling with, and I will list those resources towards the end of this video. Before I start, I just want to say that we are in a pandemic and no one that is alive right now has ever experienced this. So obviously this is not normal. You are not alone if you are feeling stressed, anxious, depressed, isolated, any kind of feeling like that. You are not alone. Some signs of depression include changes in your sleep pattern. So this can include oversleeping or not sleeping at all. It can also include changes in appetite. And again, this can be overindulging or not eating at all. Other symptoms include low energy level, difficulty concentrating, low self-esteem, and thoughts of harming yourself. Some signs of loneliness include constantly feeling tired, taking extra long showers, frequently napping, the inability to stop watching TV, or the inability to get off of your phone after many hours of use. And lastly, creating a messy environment in your home is also another sign. Some signs of isolation include extreme boredom, lack of interest in things that you used to enjoy. Another sign is withdrawal, so stopping talking to people that you used to talk to frequently, neglecting your personal hygiene, poor eating and nutrition, significant clutter, and hoarding are also signs of isolation. So what can you do if you're feeling depressed, lonely, or isolated during this time? One thing you can do is connect with family and friends. So say maybe you haven't talked to your mom or your dad in a while, give them a call, FaceTime them, Zoom with them, have a Google Meet with them, text them, anything to just kind of reconnect. Or maybe you have a friend that you could call and talk to. Another thing you could do is work out. Now, working out releases endorphins in your body and is proven to make you happier. So I know that that's kind of difficult at this time, as we do not have a lot of resources to work out. But Max is doing a great job with workout videos on our YouTube, so definitely check those out. You can also just go for a walk outside, or maybe a run if you are able to. Any kind of workout is going to help your mental health. Make sure that you're eating 3 meals a day. Don't skip meals. Don't go a whole day without eating. Don't eat junk food all day. Have 3 meals, breakfast, lunch, and dinner. Try to eat something different for each meal and space them out like you would in a normal day. This will bring normalcy back into your life and also help support your health, which in turn will help your mental health. Boosting your B vitamins can increase your energy and make you feel better. B vitamins are in citrus fruits, such as apples and oranges, leafy vegetables, beans, chicken, and eggs. Also, drink water. A good tip for knowing how much water you need to drink is take your body weight, divide it by 2, and that's how many ounces of water you should be drinking a day. Another thing you can do is get outside. The sun is starting to shine more, so make sure you get outside and you get that vitamin D. That is also proven to boost your mood. You can also listen to music, read a book, watch a funny movie or TV show. You can also have social distance meetups with friends. So now that the stay-at-home order has expired, we are allowed to meet with friends as long as the groups are not bigger than 10 and that you still maintain your social distancing and wear a mask, so you can get together with friends. All right, lastly, I'm just gonna talk about some resources if you are struggling during this time. Like I said, I'm not a trained professional, and I encourage you to seek help from your primary care physician, a therapist, a psychiatrist, a support person that you have in your life if you are struggling right now. I'm going to put this document up on the screen from Central Minnesota Mental Health Center, and they have these 2 phone numbers that you can call if you are experiencing a mental health crisis. It is a free crisis response line that is open 24 hours a day, 7 days a week, so this is a great resource. The next thing that I'm going to put up on the screen is a phone number for urgent care for your mental health, because like I said, many people are struggling right now. You are not alone in this. So if you feel that you need urgent care and that you're not currently experiencing a crisis, but you're having those feelings of anxiety, depression, loneliness, and isolation, this is a great resource. Ultimately, if you have any questions about resources or seeking help, reach out to someone, reach out to your ILS worker. They should be able to help you and find those support people in your life that you can turn to when you need help.